Hello everyone, my name is Guddato Karayu. Welcome to my today's Global Health Project. Today I'm going to discuss the health issue, which is the neonatal disorders in Ethiopia. Geographical location of Ethiopia is in the East Africa, which is also known the Horn of Africa, and the country is divided by Great Rift Valley. When we see the population of the country, it is greater than 120 million according to the World Bank report, and this makes the country the second most populous country in Africa. When we see the issue of neonatal disorders, Ethiopia has the highest neonatal mortality in the world, ranking number 4 from the top list. Now, before we deep dive into the discussion of neonatal disorders, let's see what is the definition of the neonatal disorder. Various literatures define neonatal disorders in different ways, but I found this definition a comprehensive one. So, neonatal disorder is the disturbance of the normal state of the body, the organ, or abnormal function of the newborn, like prematurity, respiratory dysfunction, birth trauma, congenital malformation, neonatal infection, neonatal jaundice, hemolytic complications, and others. Regarding the historical perspective of neonatal disorders in Ethiopia, neonatal disorders as a global level generally and as a country level in Ethiopia specifically is not a new phenomenon. It is as old as human civilization. So the focus of my discussion is here whether the neonatal disorder issue has received a political attention or not. So before 1991, Ethiopia has been ruled under the undemocratic governments, and there is no formal policy that specifically addresses the health issues of the children. So after 1991, under the EPRDF government, under the leadership of the Dr. Adhanom, the former health minister of the Ethiopia and the current general director of WHO, he gave a special attention to neonatal disorders and the maternal health, and significant achievement has been recorded. As I discussed in the previous slide, there are significant improvement in the child mortality and improvement in the maternal health in Ethiopia in the past 3 decades. But the research shows that still neonatal mortality remains high in the country. Factors that contributed to neonatal disorders in Ethiopia include corruption, poor healthcare service delivery, illiteracy, lack of trained manpower, cultural issue, and lack of both antenatal care and the postnatal care, shortage of the folic acid and iron supplements in the country. Neonatal disorder has various consequences on the society and the economy. Culturally in Ethiopia, there is a negative perception that some neonatal disorders are seen as a curse or the punishment from the God. So it is seen as a fault or the family, and It is psychologically very stressful. When we see the economic impact, economically, neonatal disorders ruins both the parents and the nation economy because these neonates are the future generation who inherit this country and take it to the highest level. And also at a family level, neonatal complication is very hard in terms of treatment and also taking care of these vulnerable infants. For example, I personally donated for a family to treat a neonate with a ASD, that is a arterial septal defect, which costed almost 1 million Ethiopian birr in the past 2 months, I guess. So it is very difficult to manage those situations as a family of disordered neonate. So in the previous slide, we have identified the key contributing factors for the increment of the neonatal disorders in Ethiopia. So that is the halfway to the solution. So the Ethiopian government need to strictly work on the corruption reduction. Second, the Ethiopian government also need to focus on expansion of the infrastructures, building the healthcare facilities and road access to the healthcare facilities and the transportation. The other thing is strengthening the health extension workers to work on the community awareness on the neonatal disorders and direct families to healthcare facilities rather than going to very dangerous, unsafe traditional birth attendants and following the both ANC and PNC with modern doctors. So this is how still the Ethiopian community are using the traditional birth attendants. So that is the cultural aspect that I recommend to be changed because home birth is common in Ethiopia, including myself. These people don't know what is the communicable diseases because they don't use any personal protective equipments at all. Still, the community trusts them, so the government Ethiopia need to pass a law that is strictly prohibits mothers to be attended by traditional birth attendants. This is just a conceptual map representation of the traditional birth attendance perception. Another solution to overcome the issue of neonatal disorders in Ethiopia include attending both antenatal and postnatal care and promotion of the immunization services, training and assigning required manpower, and increasing availability of folic acid and iron. As I stated on the very outset of this presentation, neonatal disorder is a multifaceted and complex issue that needs a synergy of different stakeholders from grassroots level to international level. Here, at international level, WHO as a World Health Organization needs to work hand in hand with Ethiopian Ministry of Health by giving technical advice and policy advice to end this neonatal disorder in the country. And also, one of the biggest donor of the Ethiopia health sector, USAID, needs to increase and strengthen the great job they are doing right now as ever before to overcome this issue of the neonatal disorders. At a grassroots level, the community education with the local healthcare workers need to be substantiated so that we can overcome the issue of neonatal disorders in the short period of time as we started to see some hope in the past 3 decades. These are some of my references. Thank you so much.